Hannah here, back with another OSCE video. So I am a UK registered nurse and a university lecturer, and also have been a OSCE lead trainer in the past, and I'm sharing some of my information and tips to help you study at home and succeed in your NMC OSCE test of competence. So today we're going to look at the evidence-based practice station. So this is one of your 10 stations in the NMC test of competence, and very similar to your professional values station, you will have 10 minutes to complete this station, and you'll be provided with a scenario and then a corresponding summary of research related to that particular topic. And what you need to do is obviously read the scenario and read the piece of research carefully and identify the main points out of that research and apply them to your scenario. And so the reason for the station is you should be able, as a nurse, to understand information that's given to you and understand the evidence-based practice and be able to give that information to patients in a way that they can understand that and in a way for them to make an informed decision and consent about their care. So that's the underpinning principles behind this station. Again, it's a totally written station, so you don't need to verbalise anything. And like I said, it's looking at how you're going to apply the knowledge of current evidence-based practice and research to your own nursing practice. And it's knowing that the care that you're giving to patients is informed by the research. So there are two key websites, because obviously this is a really important part of our practice beyond the NMC exam. So when you're out in professional practice and with your PIN, knowing where to go for the evidence base is a really important part of our professional practice. So in the UK, there's two really good sites that I recommend. One is NICE, the National Institute of Clinical Excellence, which has lots and lots of guidelines and information and brings together all the evidence to bring about to provide us with best practice guidelines, recommendations. And the other one is the Cochrane Reviews, and they've got a really extensive library where they also will bring together all the evidence on certain subject areas, certain parts of practice as well, certain treatments and interventions, and we'll bring that evidence together to form an opinion, really, looking at the evidence, whether this treatment is effective or interventions are effective, for example. So two really good key websites, which are good for practice, moving on beyond the NMC test of competence as well. So similarly to your professional values, you'll have your 10 minutes and you have one of the following scenarios. Okay, so an ankle sprain, autism spectrum disorder, bedside handover, cervical screening, cranberry juice and UTIs, dementia and music, diabetes, female myocardial infarction symptoms, fever in children. Obesity management is currently on the test centre's site, but it's not in the NMC marking criteria, so it's not currently being tested. But just keep checking the NMC marking criteria. It does change regularly, and to make sure that it's not being added in, but currently that's not being tested. Pressure ulcer prevention, restraint, saline versus tap water for wound and cleaning, smoking cessation, and then honey dressings for venous leg ulcers. So 15 subject areas there. And what you'll get, like I said, is you'll get a scenario. It'll be related to a patient. So, for example, this one, you're working on an orthopaedic ward, looking after Zy Simmons, who's admitted for pain and swelling on his left ankle due to a sports injury. And he has a past medical history of asthma. So that's an important piece of information just to keep note of. And he's been having a pain score of 4, so you offer him paracetamol. But during your round, he asks you which is more effective for ankle sprain, paracetamol or ibuprofen. And then you'll get an accompanying piece of text, which will have the research related to the treatment of ankle sprain, and will give some information on the use of paracetamol and ibuprofen and which ones are effective. And you need to pull out the key points from that research summary and rewrite them to answer Zai's question. So you must apply the findings from the research summary to your actual scenario, okay? So when you're rewriting your points, refer to the patient's name. So, for example, I would recommend to Zai that, and then give the key points from the research article. Write them in bullet points, the same as your professional values, okay? Make sure your writing is clear and legible, really important. So you don't need to necessarily remember or have a huge amount of knowledge on these areas, but it is good that you might be able to read around the subject if you're unfamiliar with it, because it will help you recall information in your exam. But all the information you need to answer that question will be within that research paper. So you've just got to go through it really carefully, read it really carefully. You can highlight or underline key bits of information from that, which you're going to pull out and rewrite as a bullet point to answer your patient's question. It is obviously essential with all of the parts of the NMC test of competence to review and look at the marking criteria. Okay, so these will tell you the key points that they are looking for you to get out of that research and give them to your patient. Okay, and like with all your stations, practice reading and practice writing to time. Okay, 10 minutes isn't very long, and you've got to be able to read, a page and a half of a research summary as well, and do your writing. So again, another skill to practice your writing, because we don't write very much now because we do everything digitally. So just a really quick overview of the evidence-based practice station, quite a straightforward station to go through and pass. Again, if you want any support or tutoring, I'm available for small online tutoring or face-to-face tutoring. Get access to all my resources, all my evidence-based practice scenarios as well. You can email me or you can visit my Facebook page.